All right, let's dive into something a lot of you have been asking about knee pain. You sent in a ton of medical articles, research on running and injuries, even some personal stories. Looks like we're going deep on this one.
Good idea. Knee pain, well, it's everywhere, but it's different for everyone, how it starts, how it affects your life.
Totally. So we'll really break it down in this deep dive. We're going past the basics into like the anatomy, how your knee actually works, even debunking some of those myths we all hear.
Sounds good. Let's do it. Where should we start?
Well, all these articles seem to agree that arthritis is a huge part of the knee pain picture. But what surprised me was, like, how many types of arthritis there are.
Yeah, people hear arthritis and they think one thing, right? But it's actually over 100 different conditions, and they all affect your joints. For knees, specifically, osteoarthritis is a big one.
Right. Osteoarthritis. Isn't that the one where the cartilage wears down over time?
Yeah, exactly. It's all about the cartilage, that smooth stuff that cushions the ends of your bones in your knee. The kind of cartilage that gets damaged in osteoarthritis is called hyaline cartilage. Think of it like your knee's shock absorber. When it wears down, it's bone on bone, and that's when it gets really painful.
Oh, yikes. So is that just like a normal part of aging or what? What causes that?
Aging is definitely part of it, but there's more to it. Genes play a role, old injuries, and you know what? Being overweight can make it worse. Puts more pressure on those joints.
Makes sense, yeah. More weight, more stress.
Yeah.
Now, the articles also mention rheumatoid arthritis. What's the difference between those two?
Rheumatoid arthritis, that's a completely different story. Not wear and tear. This one's an autoimmune disease. Your immune system is attacking your own body. In this case, the lining of your joints, the synovium.
Oh, so instead of just breaking down the cartilage, your body's causing inflammation in the joint itself. Ouch.
And it's not just the pain, it can damage cartilage and bone over time. And that can lead to like a deformed joint, even disability.
So rheumatoid arthritis is a lot more serious. Does it need a different kind of treatment than osteoarthritis?
Oh, definitely. Lifestyle changes help both types, like exercise, managing your weight. But rheumatoid arthritis usually needs more serious treatment to calm down the immune system, get that inflammation under control.
Good to know. Wow, arthritis is more complicated than I thought.
Yeah.
And we haven't even gotten to gout and lupus, which those articles mention too.
True. They cause knee pain too, though not as often as osteoarthritis or rheumatoid arthritis. Gout's from this buildup of uric acid crystals in your joints, super painful inflammation. And lupus, it's another autoimmune disease, can inflame your whole body, knees included.
So it's not as simple as just saying you have arthritis. You got to know what kind you have to get the right treatment. Before we get into that, though, what about other common causes of knee pain, the non-arthritis ones?
Good point. Lots of things besides arthritis can cause knee pain, and it really depends on your age, how active you are, all sorts of things.
Okay, I'm seeing bursitis and tendinitis everywhere in these articles. Is that
Yeah.
usually from overuse or injury?
You got it. They're those inflammatory things, in the soft tissues around the knee. Bursitis is when those little sacs of fluid that cushion the joint get inflamed. And tendinitis, well, that's inflammation of a tendon.
Right, tendons connect the muscle to the bone. So is that where things like runner's knee or jumper's knee come in?
Bingo. Patellar tendinitis, they call it jumper's knee. That's a classic example. Overuse, doing the same thing over and over, irritates the tendon connecting your kneecap to your shin bone. And runner's knee, that's often what they call patellofemoral pain syndrome. Lots of things can cause it. Weak muscles, tight IT bands, even bad biomechanics.
Whoa, wait. Biomechanics, what's that?
Ah, good catch. Biomechanics is basically how your body moves, like how your knee joint lines up and works when you move. If your biomechanics are off, it stresses parts of your knee and then, bam, pain and injury.
Gotcha. So like if I'm a runner and my knee's not moving right when I run, that could be runner's knee.
Exactly. It's more than just how your foot lands. Hip strength matters, your core, even how your foot rolls in or out when you walk or run. Everything's connected.
Wow, like a chain reaction. So it makes sense why all these articles are saying good running form is important. It's not just speed, it's protecting your knees.
Exactly. If you're having knee pain, or even if you just want to run better, see someone who knows their stuff, a physical therapist, a running coach. They can look at your biomechanics, help you make adjustments so you don't hurt yourself.
Okay, so we've got arthritis, bursitis, tendinitis, biomechanics. It's a lot. But you know what else is confusing? All the myths about knee pain. What causes it, how to treat it. There's so much bad info out
I
there.
know, right? It's crazy how many myths people believe. And it stops them from getting the right help, from taking care of their knees. Time for some myth busting, don't you think?
Absolutely. We'll do that next time. But before we go, anything else about these common knee pain things our listeners should know?
Hmm. One thing people forget is muscle imbalances. Your knee needs a whole bunch of muscles working together to move right. If those muscles are weak or not balanced, your biomechanics get messed up, and your knee joint pays the price.
So it's not just bones and cartilage, it's the whole system. Makes sense. So that's where strength training comes in, right?
You got it. We'll talk more about exercise and treatment later, but for now, let's take a break. Then we'll tackle those myths.
All right, I'm ready to bust some myths. There's so much conflicting stuff out there about knee pain. Makes it tough to know what to believe.
I know, it's a minefield. And the worst part is, believing those myths, it can actually stop people from taking care of their knees the right way.
Exactly.
Hmm.
Okay, let's jump in. A big one I hear all the time. Running is bad for your knees. True or false?
Ah, that's a classic. And thankfully, mostly false. Actually, research shows running, like if you're just running for fun, can be good for your knees.
Really? But what about all that impact, pounding the pavement? Seems like it would wear down the cartilage.
I get it. Logically, you'd think all that pounding is bad. But think about it. When you run, you're working the muscles that support your knee. They're like built-in shock absorbers.
Hmm. So stronger muscles take some of the stress off the cartilage. Is there like any research to prove that?
Oh yeah, tons. Studies show that people who run for fun, they actually have less osteoarthritis than people who don't exercise much. Gotta be running the right way though, with good form.
That's good to hear. I do enjoy a good weekend run. So moderate running, good. What about rest? I always hear if you've got knee pain, just rest, don't do anything. Is that always good advice?
Well, it depends. If it's a new injury, like you twisted something, yeah, rest is key.
Huh?
But staying still for too long, if your pain's been going on a while, can make it worse.
Why would rest be bad? Doesn't that give it time to heal?
Well, yeah, you need rest for healing. But if you rest too long, those muscles around your knee get weaker. And that makes your knee less stable, more likely to get hurt again. Plus, moving around helps keep the fluid in your joint moving. That keeps the cartilage healthy.
So it's about finding that balance, rest and movement, not too much of either one.
Exactly. And that's where a good physical therapist can really help. They figure out what your knee needs, how much rest, what kind of exercises to get you moving again.
Makes sense. Okay, so we've busted the myths about running and rest. What about popping a pill? Seems like a lot of people think that's the only answer for knee pain.
Yeah, that's another one. And I get it. Pain meds, ibuprofen, things like that, they help. You can get through the day. But they're not fixing the problem.
Just masking the pain, not the cause.
Right. If you only rely on pills, you might miss what's really going on and not get the right treatment. Plus, those pills can have side effects if you take them for too long.
Good point. So medication, it's a tool, but not the only answer. What else can you do for knee pain?
Depends on the cause, how bad it is. But usually, physical therapy is the main thing. A good PT will figure out how you move if your muscles are messed up and give you exercises to make your knees stronger and more stable.
So getting to the root of the problem, not just treating the symptoms. I saw in those articles that they mentioned injections and stuff like acupuncture too. Do those help?
Yeah, those can be good additions to treatment. Corticosteroid injections, they can help with the inflammation, ease the pain for a bit. Not a permanent fix, but it helps break the cycle of pain so you can do physical therapy or other things.
What about acupuncture? Does that really work for knee pain?
You know, there's more and more evidence that it can help some people, especially with osteoarthritis. It's thought to release those natural painkillers, endorphins.
Interesting. So lots of different tools in the toolbox for knee pain.
Right. What works for you might not work for someone else. You really need a healthcare pro to look at your knee, figure out what's going on, and make a plan just for you.
Speaking of personalized plans, sometimes I hear that surgery is the only option. Is it always a quick fix, though? Like in and out, back to normal in a few weeks?
Huh, I wish. Surgery can work great for some things, like if you tore a ligament or have really bad osteoarthritis. But it's serious. You need time to recover, and it doesn't always work perfectly for everyone.
So it's not something to jump into lightly.
Definitely not. You got to have realistic expectations, know what surgery can and can't do, and always try everything else first before going under the knife.
Right, surgery is a last resort. And it's not like it's magic. You have to work hard to recover, do your rehab.
Absolutely. Which brings us to another big myth, that knee pain is just part of getting older.
Oh, I don't like that one. Tell me that's not true.
Don't worry, it's not. Sure, age plays a role, things wear down, but you can absolutely do things to prevent and manage the pain.
Like what? What can people do to protect their knees as they get older?
Well, healthy weight, that's huge. We talked about that. Extra weight puts more stress on your joints, makes osteoarthritis more likely, all sorts of problems.
So those New Year's resolutions to get fit, they might help our knees more than we realize.
For sure. And it's not just about weight. Building strength and flexibility is key too. Exercise, especially strength training, keeps those muscles around your knee strong and supportive.
So building a strong foundation to protect the joint, are there like specific exercises that are extra good for knees?
Oh, yeah. Anything that works the muscles around your knee, quads, hamstrings,
Yeah.
calves, squats, lunges, calf raises, those are all great.
What about low impact stuff? Swimming, biking, are those good too?
Those are fantastic, especially if you already have pain or can't do high impact stuff. Keeps you moving, builds strength without pounding your knees.
Okay, so strength training, low impact exercise, healthy weight. What about stretching? I feel like that's got to be important.
You bet. Tight muscles, they limit your movement and put more stress on the joint. Stretching regularly will make you more flexible, less stiff, and less likely to hurt yourself.
So it's all connected, right? Strength, flexibility, weight, all working together to keep those knees happy.
Exactly. It's all about taking care of your knees your whole life. And it's never too late to start.
That's encouraging. So we've busted some myths, talked about different treatments.
Knee pain doesn't have to be something you just live with. Learn about it, get the right care, and you can keep those knees healthy for years to come.
And don't forget those less common causes of knee pain. We mentioned them briefly before, but let's dig into those a bit more just to be thorough.
Good idea. Sometimes knee pain is a sign of something else going on, so we should cover those less common things too. Want to do that next?
Let's do it. Unravel those mysteries and wrap up this deep dive. All right, we've covered the usual suspects for knee pain, arthritis, overuse, those biomechanics things. But now I'm curious about those less common causes, the kind of unusual ones. It's like a knee pain mystery.
Uh-huh, yeah. Sometimes your knee pain, it's a clue that something else is going on in your body. We got to figure out what it's trying to tell us.
Right, so let's be knee detectives.
Mm.
You mentioned Osgood-Schlatter disease. That's something you see in young athletes a lot, right?
Yeah, that one pops up in kids and teenagers, especially when they're having growth spurts. And if they play sports where they run and jump a lot.
So soccer practice, track meets, things like that.
Yeah.
What actually is happening in their knee?
It's all about the growth plate. That's that soft cartilage at the end of long bones. It's where the bone grows from. With Osgood-Schlatter, the tendon that connects the kneecap to the shin bone, it's pulling on that growth plate, causes irritation and inflammation.
Ouch, yeah, that sounds rough. So it's not the knee joint itself, it's where the tendon connects to the bone. Can't imagine trying to play sports with that.
It's definitely not fun. They usually feel pain and swelling right below the kneecap, gets worse when they're active, makes running, jumping, even kneeling tough.
So parents and coaches, listen up. If you hear a kid complaining about pain right there, it's worth checking out.
Definitely. The sooner you catch it, the better. Good news is Osgood-Schlatter usually goes away on its own once those growth plates close up. Usually happens by the end of their teenage years.
Okay, good to know. What can you do for it, though, while they're still growing?
Rest, ice, over-the-counter pain meds can help. Sometimes physical therapy is a good idea, too. Strengthens the muscles around the knee, helps with flexibility.
Okay, Osgood-Schlatter, check. What about that other one you mentioned, reactive arthritis? That one sounded complicated.
It is pretty interesting. It's an inflammatory thing, but it happens after you have certain infections.
Wait, infection, so not a knee injury, it's like a reaction to something else.
Exactly. You get an infection, your immune system kicks in, and then for some reason, it starts attacking your joints.
Yeah.
Knees, ankles, feet, those are the common ones.
That is wild. So
Yeah.
you could have like a bacterial infection somewhere, and weeks later, boom, knee pain. What kind of infections cause this?
Usually sexually transmitted infections, chlamydia is a big one. Also, some of the stomach bugs like salmonella or campylobacter.
Wow, so it really shows you how connected everything is in your body. What does reactive arthritis feel like? What are the symptoms?
Joint pain, that's the main one. One or more joints, usually knees. You get swelling, stiffness. The joint feels warm.
Is it only the joints?
Not always. It can inflame other parts too. Eyes, skin, your urinary tract, so you might get like pink eye, rashes, even problems peeing.
Oh man, that's a lot. How do you treat reactive arthritis?
Usually it's about managing the symptoms, and if you still have the infection, treating that. Anti-inflammatories can help with the pain and swelling. If it's a bacterial infection, they might give you antibiotics.
So definitely see a doctor if you think you might have this, so they can figure out what caused it.
Exactly. Sometimes they'll recommend physical therapy too to help you keep your joints moving.
It's crazy how many different things can cause knee pain. We went from everyday stuff to these more complicated things like Osgood-Schlatter and reactive arthritis. Really makes you realize how important it is to get a real diagnosis if your knee keeps hurting.
Absolutely. Don't try to figure it out yourself based on what you see online. A doctor can look at your knee, do some tests, and make sure you get the right treatment.
So that's our main takeaway from this knee pain deep dive. It's been really interesting learning about the anatomy, the mechanics, even those less common causes. What's the one thing you want our listener to remember?
Simple. Don't ignore knee pain. If it hurts, even a little, your body's trying to tell you something.
And don't just think, oh, I'm getting older, got to live with it.
Right. You can do a lot to prevent it, manage it, even make it go away completely sometimes. We talked about healthy habits, keeping your weight in check, exercising regularly, building strength and flexibility.
And all those treatments, physical therapy, meds, injections, even alternative stuff like acupuncture.
The important thing is to do something about it. See a professional, learn about your body.
So instead of thinking of knee pain as a bad thing, think of it as a chance to learn. Listen to your body, figure out how it works, and take care of those amazing knees that keep us moving.
Love that. I think we've reached the end of our deep dive.
We sure have. To all you listeners, if you want to learn more about anything we talked about today, check out the show notes. We've got links to some great resources there.
And until next time, be good to your knees.
Thanks for joining us on this deep dive. See you next time for another exciting journey into the world of health and wellness.